Welcome to ecancer on a sunny June month. Almost the entire month has been sunny in the UK, quite remarkable. We have a couple of papers on prostate cancer in this month's ecancer. Nigel Murray and his colleagues are talking about the outcomes of external radiotherapy only for low and intermediate risk prostate cancer, and they've been looking at circulating prostate cancer cells. And they've shown quite elegantly, in my view, that they can predict recurrence if there's circulating prostate cancer cells after the end of radiation therapy. So this looks as if it might be a prognostic marker for recurrence of prostate cancer. We continue our series of repurposing, and there's an update on Propranolol and breast cancer from Pan, who has contributed a series of papers thanks to support for his work from one of the cancer research charities in Brussels. Just when everybody's rushing into the immuno-oncology hurrah, one has a sobering case report from a patient with fatal interstitial lung disease associated with Panitumumab. This is a patient with rectal carcinoma who got a complete remission from the Grament regime, and then for maintenance went on to the same 3 courses with Panitumumab, was admitted with fatal interstitial lung disease, which is not a completely unique instance. I regret to say there have been other case reports which just highlights the issue that just because one's dealing with an antibody doesn't mean to say there will be no toxicity. And definitely the read of the month, that's quite a long and learned read, comes from Miguel Broncud from Barcelona, very experienced and very thoughtful medical oncologist who has been looking at an intriguing relationship between the placenta and serious carcinomas. This is a historic paper, it's wonderful. It's entitled Are Aggressive Epithelial Cancers a Disease of Eutherian Mammals? And if you don't know what a Eutherian mammal is, then you're not likely to know what a PIES stands for. PIES stands for placental immune editing switches, which have not evolved to prevent or to cause cancer, but their evolution was directed towards fetal-maternal immune tolerance. Of course, as we've just noted, immune tolerance can be avoided or pepped up by the most recent antibodies from the immuno-oncology pipeline. This is really quite a remarkable paper. One second paragraph starts with some 15 million years following dinosaur extinction. Read it yourself, it's just super. Our education team have been busy. I think I mentioned last month that a number of our education modules are now in various languages. The excellent 3 modules on CDK4/6 in breast cancer are up and running now. 2 of them are for doctors who manage breast cancer patients, and 1 are for cancer nurses. And they're available in German, Spanish, French, Italian. So whatever your language is, you can go and look them up. The ASCO magnificent effort of many videos which were out on the day after each day of ASCO are attracting hundreds and thousands of visits. So if you haven't been to the ASCO videos on ecancer, then go. And then the EHA, the European Hematological Association, has also been extremely popular. Within a week we had almost 1,000 visits from 4 or 5 of the interviews that we've enjoyed. I don't expect to be watching ecancer in the daylight this month, hopefully next month as well. So some nighttime viewing after the heat has died down. It's really quite remarkable. I can't recall having experienced in the UK, particularly in Scotland, such a long run of fabulous weather. I'll speak to you next month.